What are the postoperative instructions after a rhinoplasty operation? Whether you're looking to educate yourself about having this procedure or you have already scheduled an operation with us, I will highlight some important information for you to remember as you embark on this surgical journey. I'm Dr. Rodney Chan, and I'm a STARS plastic surgeon in San Antonio, Texas. This information that I'm sharing with you today applies if I'm your surgeon or if your surgeon is Dr. Davis or Dr. Granite. We've all agreed that following these postoperative instructions is important to optimize the outcome of your rhinoplasty operation. I will first go through some general instructions, followed by care of the surgical site, any restrictions on bathing or activities, and then ending with expectations and follow-up visits. This information is also in print though, if you prefer to see it that way. So for general instructions, use the pain medications that was prescribed to you when you are feeling uncomfortable. Constipation can be an issue with the use of any narcotic pain medications, and we recommend taking a stool softener at the same time as your narcotics or using prune juice from your grocery aisle. You'll be able to drive after a week, but beware that any pain medication that you take can cause drowsiness and should not be taken for a few hours if you're planning on driving. An occasional complaint after an operation involving general anesthesia is nausea. Taking pain medications on an empty stomach will make that worse if you're prone to this problem. However, it will pass with about 24 to 48 hours, and it's important that you drink lots of liquids after your operation. As to the care of your surgical site, after your operation, you'll wake up with a splint and tape over your nose. Don't touch the splint or tape and don't get them wet. You will have a bandage at the base of your nose to collect drainage. You'll be shown how to change this bandage before you leave the recovery room, and the drainage from your nose usually stops after 48 to 72 hours. After 2 to 3 days, your nose will actually not be as wet, and you'll actually start to get dry inside. And this is when you can use saline nasal spray that you obtained before the operation. You can squirt the spray into your nose and allow it to drip out. And just to make sure that you don't make a mess, have a Kleenex in your hand when you do that. Your nose will feel stuffy when you wake up, and it is not unusual that it lasts for 2 to 3 weeks. For the first 7 days, to decrease any swelling, sleep with your head on a few pillows. A rhinoplasty operation is quite delicate, and there are a few precautions we'd like you to take to make sure that everything heals in the correct place. Now, it should be obvious that you don't want to stick anything into your nose. Don't blow your nose for 3 weeks, and for 3 weeks, sneeze with an open mouth. Don't rub your nose for 6 weeks. We prefer that you not let any heavy glasses sit on the bridge of your nose for 2 weeks, especially if your surgeon had to reset your nasal bone as part of your operation. Wear contacts if possible, but if you absolutely need to wear glasses to see, use the lightest pair so as not to cause an indent on your skin. A lot of people ask about bathing and showering. On the first day after your operation, you may gently wash your face by patting it with a face cloth. Brushing your teeth is okay, but just do it gently. You will not be able to shower until the splints and tapes are removed from your nose by your surgeon. Until then, you may accumulate some crust around your nostrils. We have a separate video to show you how to gently cleanse this area with a Q-tip and a dilute mixture of hydrogen peroxide. And you'll be able to wear makeup 2 weeks after your operation. As to your activities, for the first 48 hours, we recommend resting. You may get up and use the bathroom or even take a light walk around the house. But exercise caution though in your home and be careful with tasks such as climbing the stairs, especially if you're taking pain medications. It'll be 2 weeks before you can start light exercises such as walking or using a stationary bike. Heavy exercise and heavy lifting is not permitted for 6 weeks. We prefer that you do not lean forward for 2 weeks. If you have to pick something up, bend down with your knees. Don't chew any hard or tough foods for the first week after your operation. In Texas, there's always sun around, but after this operation, we recommend avoiding the sun as much as possible for 6 weeks. If you have to be outside, wear a hat, use sunscreen with an SPF of more than 30 for a year after your surgery. And you can directly apply the sunscreen on your scar as well. It is recommended, of course, that you continue using sunscreen even after 1 year. In terms of expectations, you'll have bruising and swelling on your nose and below your eyes, and that will take about 2 to 3 weeks to subside. Numbness in various areas of your nose is common and may persist for several months. Sometimes there's a temporary loss of smell and taste as well. And remember, the final result from your rhinoplasty has to be judged no less than 6 months after your surgery and not before. You'll have several follow-up appointments after your rhinoplasty operation. The first appointment will be at a week. At this time, we'll be able to take off your splint and tapes. You'll also be able to shower once the splint and tapes are removed. Your second appointment will be 2 weeks or 3 weeks later, followed by an appointment at 6 months and then a year. We're of course happy to see you more often if there is a need. So thank you for joining me today. I hope you find this video helpful in your surgical journey with us. For more details about what to expect on the day of your operation from arrival to recovery, you can find that on our website or on our YouTube channel. If you don't find what you're looking for, leave us a comment, and that may be our next video.